So I think that we just had a discussion in the round table about that, and I would give an answer that is more global. I think that we have discussed treatment all along the day, but there is a global thinking about how to take care of the patients, and I think that we really have to consider the patient in his way of life and with his family. We have to consider how he's going to deal outside of the hospital, because now most of the care of the patients are outside of the hospital. So that's also why we need to give enough information to the GPs. We need to hire nurse practitioners, because we shouldn't think that CLL patients are only in big academic expert centers, but they are all over. So we need to improve that global taking care of the patient. And the other thing is that we do need more trials and a randomized trial and asking the right questions, because randomized trials bring more information, and we also need longer follow-up, because it's not after 2 years that you know if a treatment is best or not, because most of the patients respond anyway to any treatment, but it's in the long term that it's interesting. And I think the last point is that we have a great biological knowledge now of CLL, and we don't use it in clinical practice. And patients need to have more of IGHV, and TP53 mutation testing. Most of the patients need, and also we have more biological knowledge of genetics, of epigenetics, of immunological background that we don't use. So I think that's something that we need to reach to have a more personalized therapy.